Good morning, everyone. This is Michael Brown with the Arundel News Network, and this morning we will be covering live the press conference of County Executive Pittman. Good morning, everyone. This is Michael Brown with the Arundel, as he discusses with several individuals from both Annapolis City and the county on new actions that they are announcing jointly to curb the spread of the COVID-19 virus that in recent weeks has jumped the case rate. And I may need to step away for 1 minute here as I'm on hold with something. But those in attendance today are County Executive Steuart Pittman, Dr. Nilesh Dr. K, I'm not even going to try to pronounce his last name, Mayor Gavin Buckley of City of Annapolis, Deputy Police Chief Michelle Simpson from Anne Arundel County, Fire Chief Tricia Walford from Anne Arundel County Fire Department, and Director Petrie Emmerich, the director of the Anne Arundel County Office of Emergency Management. We're about 15 minutes away from the start of this press conference, but as of yesterday's numbers, Anne Arundel County was still seeing what I would consider a sharp increase of case rate. We were at 23.55 yesterday, only to see what the numbers are going to be like today. But the last 4 days, Anne Arundel County has been at or above a case rate of 20. On the 7th, we were at 20. The 8th, we were at 21.28. The 9th, we were at 21.88. And yesterday, or on the 10th, we were actually at 23.55. The data that comes out today is actually for yesterday. And because of that, we're always a day behind. Now, what we can say is Anne Arundel County the worst off right now? No, not in regards to case rate. That would be Allegheny County out west. They have a case rate right now of 73.24 based on the data that was released yesterday. If you guys have any questions, hit up the chat and we will try to get them. But other counties that actually had case rates at or above 20 were Allegheny and Anne Arundel. And I will have to take this. I'll be right back. All right, guys, I'm back. I apologize for that. Was on hold for the last 30 minutes with a department. Had to get some things taken care of. But like I said, we are waiting for this press conference to start. We're about 10 minutes out from this press conference, but what we were saying before I had to step away was Arundel County is not the only county that has a case rate at or above 20. Allegheny, Anne Arundel, Baltimore City, Baltimore County, and Baltimore County and Baltimore City are actually worse off than what we are. Keep that in mind depending on what County Executive Pittman announces today. Charles, Garrett, Hartford, PG, Somerset, and Washington. Now, you might remember PG was hard hit early on in this pandemic. Garrett County was actually doing really, really well for the majority of the pandemic. And back on October 18th is when they start spiking at or above 10, and they've been that way ever since. So that's a total right now of 24 days, just over 3 weeks, that they have been at or above 10, and now they're one day, as of right now, based on the data that has been released to the public, one day since they hit 20. So, as Governor Hogan has said, COVID is making a comeback in the state of Maryland, and we need, I'm going to quote him, wear your damn mask. We need to do everything we can to get us back to a normal society sooner. And we cannot rely on the vaccine. The vaccine is still months away. The hospital beds are, ICU beds are increasing this month. They started, let me look here. They started at 10. They've doubled since that's data from the 8th, actually. So we still have 2 days worth of data that we have to pull. Don't know why that didn't pull down yesterday. But we are going to be live streaming this. We are not actually at the location where County Executive Pittman will be doing this press conference. We are actually live streaming this event. So we have about 6 minutes now until the start of the press conference. So just please bear with us here as we go through this. Like we have said, to some individuals know, we do not know what he's talking about. But what we do know is County Executive Pittman has made it abundantly clear he does not think the actions that the Governor Larry Hogan took on Tuesday, that he announced on Tuesday, were enough. So I fear that we are going to have more restrictions put into place. I'm guessing more on businesses than any place else, to be honest with you. Social gatherings, I believe, are going to be affected. So I've got questions from people sending me messages on Facebook. You know, can he do this? Can he limit the number of people in a personal home? Yes, I believe he can, as he's done this, because those are what social gatherings are, right? So we all need to be mindful of this when we are planning our holiday festivities, namely Thanksgiving right now. I'm not going to go jump ahead and say, you know, things can't change or anything like that for Christmas. We're still a month out. We can still turn this around, guys. We really can, and we need to. We need to wear masks. We need to keep the physical distance. Hope that this vaccine actually is 90% effective for everyone. But again, this vaccine will not be rolled out to everyone in this country, namely everyone in this county, at the same time. They are doing phases in Maryland. I believe there are 4 phases that I heard. The last phase is for everyone. The first one is frontline workers, health, food processing workers, police, doctors, EMS, those kind of people. Then it kind of bumps up. So yes. So it shall be interesting. But we have about 3 minutes till this press conference. If you guys have any questions at all, send them into the chat and we will get to them. I will stay on here after the press conference if we have additional questions. So please send in your questions. We can either, if you have questions for the county executive, if we already know those questions, because we have already asked them, we will let you guys know what they are. Or what we can do is we can reach out to the county executive's office through their public information officers and get some questions asked. Ideally, we will be back this afternoon for the 4 o'clock press conference for Governor Larry Hogan. So let me change what we're looking at here. So right now we are, like I said, we are now waiting. We are 2 minutes from the press conference. It's supposed to be streamed on Arundel television. So bear with us. This is probably going to be this is going to be a very interesting press conference, I'm sure, to be quite honest. So like I said, if you guys have any questions at all, please send them in the chat message or send them to us on Arundel First Alert's Facebook page and we'll get to them. But as of right now, we are still waiting for this press conference to begin. They being at past press conferences such as this, they are probably getting the last minute preps done here, and they should be going live any minute. If we need to change our feed, we will to his Facebook account, but I really don't think that's going to be an issue. It's going to be streamed live on his Facebook page, Arundel TV Live, Channel 38 on Verizon, and Channel 98 on Comcast or Broadstripe. Again, those individuals that we know that will be in attendance here are County Executive Steuart Pittman himself, Dr. Nilesh, he's the Public Health Director for Arundel County, Mayor Gavin Buckley, Mayor of the City of Annapolis, Michelle Simpson, the Deputy Police Chief for Arundel County, Trisha Wolford, the Fire Chief for Arundel County, and Petrie Emmerich, hopefully I am pronouncing her first name correctly, Director, Arundel County Office of Emergency Management. So we have now hit that 9:30 time frame. So we are waiting for them to get this video up and running. We are also monitoring his Facebook page to see if it's been if it's live streamed out there yet, to see maybe if they have an issue. But just bear with us here, as we all know how technology can be. Just closing all the unnecessary pages I actually have open right now. Nothing is live yet on any page. And I'm actually checking on my phone as well. And I don't think anything is coming out yet. We're now 3 minutes past the time. Oh. We do not have any audio, though. So what we'll do is we're going to try to get out here, guys. I apologize. This is not an issue with us. This is not an issue with our connections. This is an issue this is an issue with their Facebook page. We are seeing messages saying that let's see if we can get a WBAL feed. Let's see if we can do this, guys. Because there seems to be some... There seems to be some kind of technical issues. As you can see, Dr. Nilesh is there. And now their live stream has ended. So I don't know what is going on, guys. I do apologize. Sorry, guys. I'm just sending some messages back. Let me see if I can get WBAL's feed up. if that's the case, again, I apologize, guys. This is not a networking issue on our side.
A period that will be even worse. Contact tracing cannot slow down our trajectory, and it cannot keep up with the rapidly growing number of cases. It was not built for that.
Here we go.
The measures we've put in place have prevented COVID from being worse, and yet it's not enough. Now we've reached a crisis point. The warning signs were flashing yellow, now they're red. Now more than ever, each of us has to do the basics of COVID prevention each day. Please do the following: wear a mask, watch your distance, wash your hands. In addition, we all have to limit our activities. Our contact tracing data shows that gatherings, both family gatherings and house parties, are fueling the spread. Restaurants are high risk as well because
guys, again, I apologize. I do not know what
you're meeting with folks you don't usually see.
I think it's the connection from the location. All right, guys, we're going to end this. I apologize
who continue to remain on the front
because this is not right to you guys. I don't know what the issue is right now.
But we are tired. Everyone is getting very tired. But we are seeing extremely dangerous trends in our EMS patients. We are seeing increases in the severity of a patient's condition, possibly waiting too long to call 911 for fear of going to the hospital alone, or possibly the potential to be exposed to COVID-19 is keeping them from calling. If you are experiencing chest pain or trouble breathing or potential stroke symptoms or any other severe medical issue, I urge you to call 911 so that we can help you. There are many options to address your health, such as telehealth appointments, seeing your doctor virtually, local pharmacies, and neighborhood clinics. I encourage you to choose any of these options to address your health, but always encourage you to call 911 if you have an emergency. Everyone in the medical industry is busy and overly worked at this point. We are experiencing long wait times at the hospitals and other limitations in our medical system. Again, the paramedics, EMTs, and firefighters that are out there every day are working really hard to make sure that we can provide the best service. There are only so many doctors, clinicians, paramedics, and firefighters in our country right now, and everyone is doing their best. Again, I would ask you to continue to do our part, to continue to do your part, and we will continue to do our part. Again, we are proud to serve, and we are happy to help, but it's going to take everyone, so please do your part. I will now turn things back over to County Executive Steuart Pittman.
So that was the fire chief for Anne Arundel County, Tricia Walford.
Thank you, Trish, and thank you to all of our fire and EMS heroes in Anne Arundel County for the work that they're doing. I want to stress a few things, some of the things that Nilesh talked about in particular. First of all, the numbers. We all watch the news, and we found out yesterday that while a week or two ago we thought it was pretty bad that our deaths each day were up around 700, and yesterday they were at 1,432.
And here we go. When County Executive Pittman talks, we lose connection.
Americans died of COVID. And while we didn't think we would be getting back up to 100,000 new cases anytime soon, earlier in the summer, yesterday we had 141,733 new cases reported according to the CDC. And the governor has talked about the fact that Maryland has done better than most states. In fact, we're ranked 40th in our case rate right now, our rising case rate. But what worries me is that we rank 21st in our rate of spread, in our infection rate, at 1.19. We wanted to stay below 1 because that meant that the virus was not spreading, that the rate would not be increasing. But at 1.19, we know where we're headed, and we have to act. In Anne Arundel County, our case rate ranks 7th among the 24 counties right now, and our infection rate ranks 8th, and we're in bad shape. We're in bad shape all around the state, including the small rural counties that have some of the highest case rates right now. The other thing I think we have to recognize is that while our case rates are higher than they have ever been, the situation in our hospitals is very different than it was in the spring, when our hospitals were not doing the surgeries that they normally do, and the state had asked them to stop doing that. And so we had a lot of capacity at that point. And even then, we worked on a surge plan with the state for our hospitals, to meet the surge capacity. And we were recruiting people who were retired medical professionals and medical professionals who might have been laid off or were doing other work, to recruit them to step in and help to staff the surge. And that was when the virus was mostly in the Northeast. And now the virus has gone across the country, and we don't know where we're going to be able to recruit these people from, because 40 states are in worse shape than we are. So our hospitals are operating at near capacity for non-COVID work. And so surge capacity is much harder to come by right now. So we can't make our plan to deal with the virus to build our surge capacity. What we have to do is push down our numbers so that we don't need that capacity. And then finally, I want to say that we don't hear the names of the people who die of COVID as often as we should. They often die alone in hospitals, away from their families. We've had 271 in Anne Arundel County reported, another 12 that are suspected to have died of COVID. We had one every day for a month. The last week has been a little bit less than that, but we know that the death rate follows the infection rate and then the hospitalization rate. We're seeing our hospitalization rate go up already significantly in the last few days. And when we compare the deaths of other things that we can prevent, and we look at what we do to prevent those deaths.
In the past week, Anne Arundel County has had one death, and that was actually yesterday.
Deaths from traffic accidents, from gun violence, from opioid addiction, overdose. We have to work hard to prevent death from COVID. So the governor made an announcement Tuesday And I want to commend the governor for having flattened the curve in Maryland. We did the hard work back in the spring. When actions were taken to limit the mobility of our residents statewide, it worked. It absolutely worked. We all know that. The numbers came down. I was disappointed that no actions were taken across the state that I believe will lower the spread of the virus. What was announced was a reduction of restaurant capacity from 75% of fire code to 50%, and no restaurant that I have heard from thought that they could go to 75% because we have restrictions, state restrictions on how many people can be at a table and how far the tables can be apart. So the 6-foot distancing was preventing them from going to 75% anyway. So reducing it back to 50% will not decrease the spread in restaurants. Establishing an indoor social gatherings limit of 25, to me, is not enough. My house is not all that big, and I can't imagine inviting 25 people over and hanging out in my living room in the middle of a pandemic. So we want to discourage people from having those kinds of numbers in their homes. And then saying that we're going to increase enforcement is something that it happens at the county level, and I can tell you how hard we have been working at that and how we have brought people in from all departments of government to help with the enforcement efforts and how difficult it is. The job is to educate our businesses and our community, and just saying we're going to do more enforcement in itself, I don't believe is going to push down the spread. So I've been talking to the other county executives, particularly in Central Maryland. We have been on the phone with each other every week. We were on the phone with each other yesterday on Veterans Day as well. And without state action, we need to move regionally. And so I know that Baltimore City has already taken action. I know that there's a press conference very soon in Prince George's County where they are going to be taking action that does have the potential to slow the spread of this virus. So those are our neighbors to the west and to the north. We don't want to leave them hanging.
So this is Michael Brown with the Arundel News Network, guys, and you are watching
Maryland,
the County Executive Pittman
tomorrow. Every week, we Friday with each other.
Ooh,
Social
we have a
gatherings.
double feed here, guys. I apologize.
Will be limited to 10 people indoors. Without state action, 25, we need people outdoors regionally. And we're doing this because our contact tracing in Anne Arundel County and across the state show very clearly that social gatherings are spreaders. And unlike businesses where we have somebody in charge who can implement best practices and enforce them, we don't have that in social gatherings. And unlike businesses, when we limit social gatherings, we're not putting people out at work. We are inconveniencing people outdoors. But people doing this because our contact tracing. So that's our first step. In Anne Arundel County and across the state show very clearly we are starting gatherings are spreaders. And unlike businesses where we have somebody in charge who can implement best practices and enforce them, we don't have that in social gatherings. And unlike businesses, when we limit social gatherings, we're not putting people out at work. We are inconveniencing people. But people need to step up. So that's our first step. Second, we are starting Monday suspending our rec and parks youth sports. Now, it's a good time of year to do that because we're winding down most of our fall seasons and about to start our winter seasons. Basketball is probably the sport most impacted. My twin boys played basketball in a rec and parks league last year, and they're disappointed. But I know what it was like to be in those small gymnasiums at elementary schools with two teams battling away on the court and a line of.
So this is Michael Brown with the Arundel News Network, and you are watching live County Executive Pittman's press conference on COVID-19 in Anne Arundel County.
And then finally, the decision that has been most difficult for me has to do with bars and restaurants. And we know that you can't wear the damn mask when you're eating. And you can't wear the damn mask when you're drinking. So we're in our restaurants, in our bars, without our damn masks. We have limits on them. Anne Arundel County stayed at 50%. Anne Arundel County also closes bars and restaurants at 11, last call for drinks at 10. And that helped when we did that. Other counties have followed our lead on that, and many other states are doing that as well. The debate has really been over whether to go back to curbside pickup or whether to limit the capacity indoors in restaurants further. And what we're choosing to do is to limit the capacity indoors in restaurants from 50% to 25%. And I understand that there are going to be restaurants that make a decision that they can't operate profitably with that restriction. I hope there are not many of those. I hope that the residents of this county step up and do takeout. They get just as much money, and you can tip generously. We were doing that when we had curbside pickup at restaurants or takeout only, and I think we need to get back in that habit, picking up our meals at our restaurants and bringing them home and eating them there. But we're allowing them to continue at 25% capacity for now. And I know there will be some who will ask us, why only restaurants and bars? What about other businesses? What about retail and others? I have been very reluctant to do anything that might cost people their jobs, might put people out of work, especially right now when the federal government is not providing the support that they were earlier in the pandemic. And I want to thank and recognize the whole business community for the work that they've done figuring out how to operate safely, implementing best practices. We've invested $3 million from our Economic Development Corporation.
So guys, in short, rec sports are suspended effective Monday. Inside groups are now limited to 10 or less. I believe that starts on Friday. And bars and restaurants capacity is being reduced by 25% from 50% to 25% are the three announcements so far from County Executive Pittman.
Finally, I want to say that we understand that the restrictions, the virus itself, the fact that people are not spending money in restaurants and they're even shopping online more. We get that. The economic impact is an impact on people. It's an impact particularly on lower income people. And that's why we're spending so much of our effort and our resources at the county level in eviction prevention and food assistance and all of the holes in the safety net that we're attempting to fill. And we will go to the ends of the earth to do that. That is our top priority. And for restaurant owners, I want them to know that they can not only access our $10 million, this is our largest coronavirus investment, $5 million of our CARES money and $5 million of state money through Economic Development Corporation for direct assistance. But their employees can also get help. And we're encouraging restaurant owners to call on behalf of their employees that they know are in trouble and seek help. So we have our COVID care teams that not only can provide our $500 cash assistance, but also help with bills, help with eviction prevention, and any other needs that people have. They can call the food hotline to get connected to those services at 410-222-FOOD. And as far as additional assistance, we are talking to our members of Congress, and we'll be advocating for additional federal assistance, particularly for unemployed folks who've been put out of work, and we have some optimism on that front as well. And we'll be continuing to communicate with the residents of this county. We have a recovery group that we've been meeting with regularly to talk about the steps that we're taking, opening or closing. We're going to be broadening that and doing those virtually with the public participating. So the first of those will be next week, so that people can weigh in, both business community and others, about the actions that we take and others that we should take. So I guess finally, I just want to appeal to the residents of the county that we really are in a war with this virus, and we have done well. We have won some battles, and this is a war where everybody's enlisted, and we cannot afford to abandon our posts. We cannot afford to desert in the middle of this, as we're nearing the end of this, we believe. So stick with us, please. As Governor Hogan has said, we're all in this together. And as Dr. George Everly has said, division delays recovery. So if we work together, we can absolutely push these numbers down as we need to. So one of our most important partners in this is the City of Annapolis. Gavin Buckley, himself a restaurant owner, will get up and say a few words about the work that they're doing in Annapolis to help us crush the curve.
Good morning, I'm Mayor Gavin Buckley, Mayor of the City of Annapolis.
Looks like we have another technical issue with their stream. We'll see what we can get it worked out here. Again, that was Mayor Buckley from Annapolis.
That war, unless we believe that the enemy is deadly, and unless we all fight this purge together. So I want to thank County Executive Steuart Pittman for having me here today, and Health Officer Dr. Kalyana Raman for inviting me to say a few words today. I'm proud that we are partners and that we're in good communication regularly. And I'm sorry that the pandemic numbers of our county are trending in the wrong direction. I'm especially sorry that this data is revealing itself just as we come into the holiday season, which is so critical to our Annapolis local small business community. I know that Steuart and Dr. K are working hard to balance the needs of public health with the dire economic consequences as a result of tightening restrictions. The steps they are taking today are significant because they are heeding the warning lights. I know that the public is weary. I'm in contact with business owners and business associations on a daily basis. I know that the economic toll this pandemic has taken on workers and businesses were tempered somewhat by the CARES Act funding and by PPP loans, both of which bridged the gap in lost revenue for business, lost wages for workers, and lost tax dollars for the city and the county. But there is still a lot of pain out there. Economic pain for our businesses and emotional pain for nearly every person in our community. None of this is easy. I urge elected partners at a federal level to find a way to advance legislation for another round of funding. We also need a national pandemic response plan because of the travel between states that will definitely impact Maryland. We must have a coordinated response if we are going to not only get to the other side of this, but we also need a national response in order to manage deployment of a vaccine when it is ready for distribution. The federal government's disastrous response in spring can't happen again. My concern today is the holiday season. We see the numbers of infections rising. There is a bit of a delay, but shortly after those numbers go up, we see the numbers of hospitalizations go up. Then the numbers of deaths. There are consequences. If you are not feeling well, please stay home. By now, we all know the symptoms. Fever, cough, fatigue. Just stay at home. I don't want us to lose one more Annapolitan to this virus. Contrary to what we hear on social media, it is at least 4 or possibly more than 10 times deadlier than a seasonal flu. We all have to take personal responsibility for our actions. We are begging people to do the things that can mitigate spread. Properly wear a mask, watch your distance, wash your hands. The City of Annapolis is prepared to enforce mask wearing and break up large gatherings and shut down businesses who are not doing this. You have to care enough about your fellow humans and hold yourself personally responsible for your own pandemic protocols. Our local downtown businesses need your support, not just in shopping locally or opening your wallets, but in slowing the spread. You can continue to support businesses, get carry-out orders, tip generously, dine outdoors, in retail, do curbside pickup. There is nothing that will ruin the holiday season for your family or your friends and for our community, especially our business community, than to see the numbers of cases and deaths rise in the city, the county, and our state. Please take personal responsibility for your actions in order for businesses to stay open, in order for our community to have a holiday season. We are counting on you. Please help us get through this together. Thank you all. I think now we'll step up.
Again, that was Mayor Gavin Buckley of Annapolis City speaking.
We've seen a lot of the big tents being put out that now have the walls on them, and is that a concern that you're just basically creating indoor space, that it's no longer an open outdoor space with no ventilation when all those large groups of people are in the big tents with the walls down?
Yeah, I'm glad you asked about that, because we get comments from residents about that too, when the walls come down. That's considered indoor space. And so they're under the same guidelines to separate their tables, numbers of people at tables, as indoor space in the building.
How does that work with the capacity numbers with the fire code?
So they are 25% fire code capacity indoors, and what we were doing before is that when they were at 50%, is letting them use that space to get towards their 100%. So we're still allowing them to do that. So if they add tents, they still do that, but they have to maintain the distancing.
We're 2 weeks after Thanksgiving. What do you tell people who want to gather with their families still, for the holidays?
I tell them, learn how to use Zoom. That's what we're doing. We're planning to connect with other family members through Zoom. If they can eat outdoors, let's hope for a warm day, and really take the time to connect every way we can. But when you have a large group of people gathering together, you're going to spread the virus, particularly if they're people who are not don't normally see each other. And then of course we know that people can get tested before and then quarantine from the time that they test, if they test negative, until they see each other to protect themselves as well.
County Executive, you alluded to the fact that fighting this pandemic is like a war. The lights were a little dim at the time you referenced that. Can you re-reference that for the county?
Sure. Yeah, I mean, we are at war with this virus, and we have had success in the early battles of this war, and we can see victory down the road with the vaccination success in the trials. So we hope that by this time next year, things will be pretty close to back to normal. So we have to finish the job we started, and nobody should abandon their posts and desert in this war.
I got two questions. First, have you considered, or is it maybe down the horizon to institute a mask mandate like the city has? And then second question, with restaurants going down to 25% capacity, with social gatherings going from 10 indoors to 25% outdoors, when it comes to
25 people outdoors, yeah.
When it comes to retail, we saw the grocery stores and the big box stores limiting the amount of people that could come into the store. Does that come from you or the state? Could you do that? Because it seems like that would be, if we're going to do all these other things, people can, you still have hundreds of people in a Walmart.
Right.
So
Right.
I'm just curious, first the mask mandate, and then can you take steps to curb that?
Yeah, that is on our list for enforcement. We're in conversations about how to enhance our enforcement efforts. And one of our concerns, especially with the holiday season's coming and a lot of shopping going on, is big box stores and grocery stores that were very careful about the numbers that they let in early on, and many of them are no longer counting. And we've started to see larger crowds in those stores. So we will be working with them to get back to those activities.
Okay. And then the mask mandate, have you thought about that at all?
Yeah, well, we implemented, in fact, before the state of Maryland, the mask mandate that says, indoors and outdoors, when social distancing cannot be maintained, that masks are required. Hasn't been enforced as well as we would like, especially in some situations. So we have that, and we're going to continue to figure out ways to enforce it.
Thanks.
A question for Mayor Buckley. You have Midnight Madness coming up in the next several weeks. Is that still planning to move forward? I mean, a lot of people in downtown.
I think we're reacting to this week by week, so we have to make those calls as the situation develops on the ground. So obviously we would like some of those things to be in place to help our retailers, but at this point we have to kind of see the situation as we get closer.
I have a question for the health officer also. Can you explain, one of the issues that a lot of hospitals and medical facilities had back in March was they didn't have enough PPE, they didn't have enough resources to battle this. Do you feel that they do have enough PPE now, but they're just seeing more people come into these facilities that they can't handle it? Or maybe if you could just explain how these hospitals are doing and how bad it really is?
Yeah, so in March, April, May, one of the things that happened was that elective procedures were canceled, and frankly, fewer people were moving about, and we saw the effects of that on their health. And so there was both space in the hospital, there was staffing in the hospital, there were PPE challenges, but it was being diverted to COVID purposes. Right now, the hospitals are operating at a normal capacity, which is near full. What's different now is a couple of things. One, we're not asking them to defer routine care, and we don't want to get into that position. The second is that while our PPE stocks are good now, the challenge we have is that every single state in the country is on the way up, with 40 plus states in the red zone. Emergencies are meant, when emergencies are happening, the emergency management system is meant to divert resources from places that are doing well to places that are not. If everywhere is doing poorly, we're going to run into shortages. We saw that with our testing that happened this summer. We were doing well, but because of increased hotspots throughout the Southwest and Southeast, our testing numbers were delayed. That's happening throughout the entire country now. So that's our challenge, is that our hospitals are having to compete not only with others in the state, but others in the country for staffing and for PPE. And so through no fault of their own, we're all going to be in a bad spot if we don't get control of this quickly.
Thank you.
Hey guys, just real quick, as I mentioned,
Since we're about 2 weeks out from, since Halloween, are you maybe attributing some of this to Halloween activities at all?
Unfortunately, the rapid rise that we're seeing, we're not going to be able to detect a signal from Halloween, to be quite honest. Whatever blip is there is being swallowed up by just the rapid spread through all the other means.
Thank you, everyone.
One more question. Can you talk about the app just really quickly, encouraging folks to go?
Sure. This is the Empty COVID Alert app. It's meant to enhance our contact tracing. It's a feature that you need to enable if you have an Android or an Apple iOS phone. It essentially allows the phone to detect how long you are near different people. It's a passive system, and it only gets transmitted if you say, I have COVID, I am opting into this, so that other people can know, or you say, I have this app and I want to be notified if I was a contact. But it's a way to enhance our ability to do contact tracing, because you may be in situations where you don't know the name of the person you're with. You're on the line at the grocery store. You were at that sports event. You were unfortunately at a party and you don't know everybody there. But it's a way for us to enhance contact tracing. And so we recommend that people do download that app. And
all right, guys. Well, that's just interesting. They cut out the feed before Dr. Nelesh was able to fully answer the question, but he was talking about the Maryland COVID app that has been that was announced this week, where you have to opt in and say you have COVID, or you have or you want to be notified if you come in contact with someone that has had COVID. But breaking during that press conference from Steve Dye, the weather guy, he's informed me, and I said it in the chat, Maryland has announced another 1,000 case day. This is the 9th straight day that Maryland has been over 1,000. I'll be looking at the numbers to see where we are in Anne Arundel County. But we had 1,477 cases announced in the last 24 hours. Again, this is the 9th straight day of over 1,000 cases. So as the governor has said, as the county executive has said, as the mayor of Annapolis has said, and as the health director of Anne Arundel County has said, wear your mask, don't go out unless you have to, and keep at least 6 feet distance from anyone. Now, we did receive an email from the administration at the end of this press conference where they outlined the 3 new restrictions. So effective Friday, November 13th at 5 p.m., the maximum number of people permitted at a social gathering are 10 indoors and 25 outdoors. A social gathering is any informal gathering of people that is not explicitly covered in other current executive orders. That's important to note. Effective Monday, November the 16th at 8 a.m., youth athletics are suspended for all county fields and facilities. So I did receive a message. Let me go back and read the message so I have it correct. Oh no, it wasn't about that. I apologize. But all athletics that are at county fields and or facilities are hereby suspended as of Monday, November 16th at 8 a.m. Effective Friday, November the 20th, the maximum capacity for indoor dining operations in restaurants, bars, and any food service establishment will be reduced from the current 50% to 25%. Now, that being said, the state is in a phase 3, which allows 75%. But the county had further restrictions on what was allowed, as that is allowed. In addition to that, there were questions that were sent to me during all this. Is this going to affect private school classes that are now going to be required to be 10 people? And is there any possible way that the Governor Hogan can override any of this at 4 p.m.? The answer is, I don't think Hogan, because of how the state law is written, Governor Hogan can chastise any county. He's done that before. He's called out County Executive Pittman. But I don't think he's going to be able to override any of this unless his restrictions are more restrictive than what the county has. And based on the 10 people indoors, based on the definition, that should not affect private schools, as that's not informal, and that is covered under additional orders. So I was trying to give you guys some updates throughout this event, and I apologize if I was talking over, but I thought that information was important to get to you at that point. So that is it for us right now for the county executive's press conference on COVID-19, on the new COVID-19 restrictions. Again, those restrictions are as follows. Effective Friday, November 13th at 5 p.m. Maximum number of people permitted at a social gathering is 10 indoors and 25 outdoors. Effective Monday, November 16th at 8 a.m. Youth athletics are suspended for all county fields and facilities. And effective Friday, November 20th at 5 p.m., the maximum indoor capacity is now 25% from where it was at 50% for bars and restaurants. Toxic rain 746. Nothing was explicitly said about county employees, but what Governor Hogan did state was, anyone that could telework should be teleworking. I've spoken with county departments myself for personal issues in the county, with my residents, with my community, and they're all teleworking because they can't transfer from one department to the other anymore because of these things going on. Bria Miller 82, did they say anything about hair salons and spas? No, they actually did not, and I'm actually kind of surprised about that. Really, what they're seeing, what they were stating, was bars and restaurants and informal social gatherings. On Arundel News Network, we do have the press release that was emailed. We will be posting that on our Facebook page. So please take a look at that here shortly. We'll have that up as soon as possible. Again, that pretty much wraps up our coverage of County Executive Pittman's press conference on his new COVID-19 restrictions. And we will be back about 3:45 for the 4 o'clock press conference with Governor Larry Hogan on updates that he is sharing just 2 days after he already had a press conference. Calvary Chapel, an Imperial Reaction, churches and worships are covered under additional orders, they were not explicitly mentioned in the press conference nor in the press release. So you guys are, how I look at it is you guys are allowed to continue worshiping in the fashion that you guys have been within these restrictions that have previously been stated. So like I said, that does it for us right now, and we will be back about 3:30, 3:45 this afternoon to cover Governor Larry Hogan's press conference on COVID-19 in the state of Maryland. Until then, I'm Michael Brown for Arundel News Network. Thank you for joining us. Have a wonderful day. Stay safe out there, everyone.